Okay, today I will be performing trach care on a patient with a tracheostomy tube. First, I will check the patient's charts for any indications that the trach needs to be clean. Of course, any indications that the trach needs to be clean is it hasn't been cleaned today or that it's dirty. So it's important and imperative to clean the trach to prevent some of the complications, including infection. Next, I will gather my materials. I will need a stethoscope, my trach care kit, my regular gloves, and peroxide and sterile water. So first I'm going to put on my first I'm going to either wash my hands with soap and water or with an alcohol-based cleaning solution. I'm going to put on my gloves, which needs to be a size smaller than you usually wear, because later you're going to put on sterile gloves over these. I will go ahead and suction the patient, making sure I use a pop and twist method. And then I'm going to auscultate the patient to make sure that everything is good for us to remove the inner cannula for cleaning. Both sides, bilateral chest. The patient sounds good and he's ready to be suctioned. So I'm going to use these gloves to take off the old gauze and discard of it. Next, I'm going to open my kit and take out my gloves and put them on sterilely.
There's the speaking valve and a Okay, what are three complications that can be associated with the treatment? Subcutaneous lymphedema, infection, or hemorrhage.
This is a sterile procedure, so it's imperative that everything is done sterilely. Gloves on. I'm going to take out my trach care equipment.
Keep it rounded. So what's it called? It caused any damage. Oh my God. Oh crap. Not saying check to make sure it's like alright. Oh, that is crucial. I don't know what I was doing.
I'm going to put in one side sterile water and the other side peroxide and sterile water mix, half and half. I'm going to put some of my Q-tips in one side with the sterile water and then the other Q-tips in the other side with the peroxide and sterile water mix. Next, I'm going to use the peroxide and sterile water Q-tips to clean the stoma with an outward motion going away from the stoma.
Yeah, I didn't do well.
Next, I'm going to take my Q-tips with the sterile water on the ends, soaked in sterile water, and go over what I cleaned with the peroxide and the sterile water mix, using an outward motion away from the stoma once again. I can also use extra Q-tips or gauze soaked in the peroxide and sterile water mix to clean the outside of the stoma. And then the ones with just the water on it to make sure I get the peroxide off. Next, I'm going to take the cannula off, putting in a disposable cannula to replace it, and put the cannula in the sterile water and peroxide mix for cleaning. I will use this brush to go down into the stoma to remove any gunk and anything else that's in the cannula, outside as well. use my pipe cleaner for the little pieces that might be stuck on inside the inner canal.